For this video, I'm going to be drawing up insulin. I'm going to start by verifying that it's the right patient, drug, dose, time, route, and documentation. After I have verified that, I am going to make sure I have all my supplies ready, and I'm going to verify the medication with the electronic health record. So today the order is for 4 units of regular insulin and 8 units of NPH. We're going to be mixing them for today, and it's going to be injected subcutaneously into the abdomen. After I have verified all of that, the order also says that this medication is to be given before breakfast, so we'll be giving it before the meal. And once that is verified, I'm going to provide privacy. I'm going to introduce myself, tell them that my name is Madeline, I'll be their nurse today. After I have told them that, I am going to ask for 2 forms of identification, first and last name and date of birth. Once they have verified that, I'm going to ask them if they have any known allergies. This could be allergies to medications, to food, etc. Once they have verified that, I'm going to explain to them that I will be giving them a subcutaneous injection of insulin, which I will compare to my electronic health record. And before I even draw anything up, I'm going to check their blood glucose levels to compare that to how much I'll be giving them. So once I verified that, I'm going to say that their blood glucose level was 160. So this is before they had a meal. And then I will also ask them when the last time they ate was, because this will also contribute to how much they're getting. Once they have verified that, I will also verify again with the electronic health record that they'll be getting 4 units of regular insulin and 8 of NPH. I'll be mixing them, which will be a total of 12 units of insulin. I'm going to explain to them that insulin is used to control your blood glucose levels, especially with the NPH being the long-acting. They work together to control your blood glucose levels. So when the blood glucose level starts to go up, the medication is going to help control and bring it to where it should be. Some common side effects of this medication are hypoglycemia, which is also considered as low blood glucose levels. Itching is also another side effect. After I have explained that to them, I will let them know that when I give the injection, they might feel a stinging or a burning sensation, and to let me know if they have any adverse effects at all. I'm going to also ask them if they have any questions before I do anything. And then after that, I'm going to start getting prepped. So I'm going to do hand hygiene and apply a clean pair of gloves. Again, I'm going to be checking the electronic health record because I want to make sure that I'm giving the right amount of medication. So I will be giving today 4 units of regular insulin and 8 units of NPH. We're going to be mixing them today. So there's a couple steps that we need to go through that are really important. So first thing is that I need to clean the tops of the vials, and then I'm going to explain what the steps are and procedures for mixing. And with the insulin, it's really important, if it has been refrigerated, which some insulin is, it's important to let it sit out until it reaches room temperature. And then I'm going to roll it. You're not shaking it, just rolling it. Don't touch the top, it's already been cleaned. Just roll. Okay, and now with this, we are going from clear to cloudy. So because I am going to actually be drawing up my regular first, I need to start by putting air into NPH first, because NPH I will be drawing last. So I'm giving 8 units of NPH. So I'm going to draw back 8 units on my syringe here. Once I have that, I'm going to inject it into the NPH, making sure that the needle is not touching the NPH insulin. And with the same needle, now I'm also going to be drawing back 4 units of air, because I'll be giving 4 units of the regular insulin, and then I will inject the 4 units of air into the regular insulin. And now I'm going to tip my vial and I'm going to draw back 4 units. If I happen to get any bubbles, I'm going to have to remove those before I go into my NPH. You can do this by just hitting the side here, or even pulling back and pushing back up. Perfect. So I'm just going to show you here. I have 4 units. Okay, now that I have the 4 units of the regular insulin, which is the clear, now I'm going to be injecting it into my NPH and making sure I'm not mixing the regular into the NPH. You don't want any to eject. We are just simply putting it into the NPH vial and drawing back exactly 8 units. And I'm comparing this again to my electronic health record to make sure that this is correct. Do not go over and draw more, because you can't push them both back into the vial. So 8 and 4 is going to be a total of 12 units. Perfect. Just going to be checking to see if I have any bubbles whatsoever. Everything looks good. I don't have any bubbles, and I have exactly 12 units. Now that I have this done, if for some reason the medication is not at bedside, it's important to make sure you put the patient's name and the amount of units or the dose on to the syringe here. So that way we know what we're giving if we're giving it later. After that's been done, I'm going to put that there. Remove my gloves, do hand hygiene. And that completes the video.